road not far away. Let's talk story. It's where my mama was born, it's where I come from, it's where my daddy fell in love not long ago.
Let's talk story.
Well, a little of this and a little of that. Funny how time just slips away.
Cuz, we gonna talk story.
Eh? Let's talk story. Talk story. Talking Let's talk story. Let's talk story. Talking story. Time for friends to share. Time to hear what's new. Hey you,
Oh, me.
over there,
Over here.
how's life been treating you? Hey brother, big up call. Yeah, whip up yellow.
Well, there's just one thing I gotta say. Bust out all the tools that we can play. Anytime you need a
Velina mai meke aloha e kalehulehu. My name is Haley, and I am a rising junior in the Beaverton School District. I am also one of the proud members of Nakamli'i Talk Story, Inquiring Minds of Today's Youth. We are a part of the Education Committee of Ka'ahalahui o Olakona, a Hawaiian Civics Club of Oregon and Southwest Washington, a nonprofit organization with a mission to actively participate in the promotion, perpetuation, and practice of the Native Hawaiian culture and values. One of our goals is to participate in activities which promote the civic, economic, health, education, and social welfare of our community, and particularly the activities of those agencies and clubs who are responsible for the improvement of the conditions of the people in the community. Through these efforts, Nakamli'i Talk Story is a program offering a safe place for open discussion and conversations around social justice, equity, equality, cultural appropriation, climate change, and education that will be led and driven by today's youth. Before we get started with today's talk story, as a community organization here in Oregon, we would like to acknowledge and mahalo the land and its people to which we sit and occupy. The Lenape story about the great turtle is shared by the indigenous peoples of the northeastern woodlands and carries throughout all of North America. Through these stories, we continue to learn about those who have stewarded these lands since time immemorial. We would also like to express our appreciation and respect of the indigenous peoples' inherent kinship beliefs when it comes to the land, especially since those beliefs were restricted for so long. As members of the BIPOC community, we know the importance of acknowledgement, and we encourage you to learn more about the lands we currently occupy by visiting native-land.ca. The United States was built on broken treaties. The lasting effects of federal and state policies, both past and present, have put Native Americans at a disadvantage for hundreds of years. is on all of us, whether we are descendants of colonizers or inhabitants of stolen land, to re-educate ourselves and each other. Aola. As youth leaders in our communities, we understand that bringing awareness to certain issues such as COVID-19 are important. We know that there are many, like us, who continue to seek answers to help our peers make informed decisions. For me, getting the vaccination meant that I would be participating in keeping our community safe. But for many, the vaccine can be scary. Hesitancy around vaccination has definitely been an issue amongst our generation, being a generation who has been raised with technology at our fingertips. We are often challenged with whether or not the information we are getting is true. We hope today's talk story provides an important opportunity for all NHPI youth to have the conversations that will help answer the many questions we keep asking. So with that being said, I would like to introduce our moderator for today, Mayma. Mahalo, Haley. Aloha, my name is Mayma. I am a rising sophomore in the Beaverton School District, and my pronouns are she, her, hers. Before we begin today's talk story, I would like to introduce and welcome our special guest who will be joining us today. Uncle Richard Leman is Chief Medical Officer for the Health Security, Preparedness, and Response Program Medical Epidemiologist and Tribal Epidemiology Liaison in Acute and Communicable Disease Prevention at the Oregon Public Health Division. Uncle Richard has been with the Public Health Division since 2002. Before that, he completed an Epidemic Intelligence Service Fellowship in Applied Epidemiology with CDC and worked with the Indian Health Service National Epidemiology Program throughout the 2 years of the fellowship. He is board certified in family practice and worked as a family physician for a number of years with the Multnomah County Health Department and with the Siletz Community Health Clinic. Aloha, Uncle Richard. Next is Dr. Kim Bonner is an Epidemic Intelligence Service Officer at the CDC, working at the Oregon Public Health Division. She received her PhD in Epidemiology and Community Health from the University of Minnesota and a Master's in Public Affairs from Princeton University, along with a bachelor degree in Molecular Biology from Princeton University. Prior to joining the CDC, Dr. Kim worked for Doctors Without Borders in Switzerland, Kenya, Sierra Leone, and the United States, and with the National Malaria Control Program in Tanzania. Aloha, Dr. Kim. Aloha and mahalo everyone for being here today. So to start off today's talk story, we actually have a question coming from one of our Nakamali Talk Story members, Haley. Aloha again. I'll be starting off with the first question. There are some people who are avoiding getting vaccinated due to comments and views that others have been sharing based on their experiences with the vaccine, generally the overall physical pain. What are some reasons you think are behind people choosing not to get the vaccine?
Dr. Bonner, shall I tackle that one?
Please, I'll go next.
Okay. So yeah, I think it's understandable that people don't like to do things that are uncomfortable. But at the same time, I think you bring up a really good point, Haley, and that is getting a COVID vaccine isn't just about protecting yourself or whether it hurts a bit when you get the vaccine. It's really about protecting other people. It's about protecting our kupuna. It's about protecting other people who really risk severe illness if they get infected with this. And since we have vaccines that appear to be very effective, I get it. It's not fun to have I had a sore arm, but I decided I'm going to get this vaccine because I want to protect people who may not be able to get the vaccine, or my mom. I want to protect my mom. I want to be able to hug my mom and do it and feel good about it because I don't feel like I'm putting her in danger.
Dr. Kim, would you like to share any thoughts?
Sure. I think like Dr. Leman said, it can be hard to do something that may feel uncomfortable or may feel a little scary. But I think the motivation is when we are getting vaccinated, we're not just protecting ourselves, we're protecting our community and our loved ones. And that is such a motivating thing. We care about so many people in our lives. And so we're doing this not just for ourselves, but for them.
Mahalo. I agree. Like there are just the benefits definitely outweigh the physical pain we may experience, and it's important to keep our community safe in these times.
Mahalo, Haley, for asking your question. For me, I got like a sore arm on my right for my first vaccination. Like many others on my second vaccination, a lot of people say they had the flu or they had the chills, but for me, I just got a simple headache. And when hearing those comments, I too got scared inside, and that kind of restricted me from getting the vaccination also. But after getting it, it was worth it. So, mahalo. Our next question would be by Kina.
How can we better educate our working communities, specifically our BIPOC communities, in order to reassure their safety, their future, and support?
Kina, thanks so much for that question. There are some really important messages to share here. And one is that these vaccines are very effective in preventing most infections. And if an infection does develop, it's likely to be much, much milder. Any sort of adverse effects or reactions are really quite rare. And what's great about this is if there's less likelihood of potentially transmitting to someone else, to a vulnerable member of our community. And this is what, for us, that COVID vaccine is about. This is why I got vaccinated, so I could give my grandma a hug, because I want to protect my community, my loved ones. And I think those messages are really shared throughout and are just very, very motivating.
Mahalo, Dr. Kim. Uncle Richard?
And I would agree completely. I think those are really important messages when we talk to people, and people may be hesitant, and they may worry about it might hurt my arm, or I might feel tired after the vaccine. But again, I think the key message is you've got a vaccine that's effective. Side effects are rare, and this is something that you can do to protect people you care about.
So remember, Kina, since you didn't get the vaccination yet, since you're not at that age, just remember that you're not only helping you with your health, but you're helping many others. So remember that. Mahalo. Mahalo, Kina, for your question. So our next question comes from Sophia.
Thank you. My question is, if someone has already gotten COVID-19, in what ways would their antibodies protect them?
Thanks for the question. And yeah, I think vaccination still makes sense even if someone has had COVID. It does generate antibodies, but we don't know for sure how long that immunity lasts. And we do have pretty good evidence that when people get the vaccine, it strongly boosts immunity. And so we don't know for sure, but we think that may make it so that somebody is protected for longer. Also, as we've all heard, there are different strains of COVID vaccine, of COVID infection, COVID virus. And the vaccine seems to be effective in dealing with a bunch of those, whereas we don't really know if somebody got infected early on in the pandemic, whether that infection and the immunity that was generated is still going to protect them against other strains. So that's another reason to consider, and that we would recommend getting vaccinated, even if somebody had a COVID infection. Dr. Bonner, any other thoughts on that one?
Yeah, thanks so much, Dr. Leman. Like you noted, this is recommended. So the COVID-19 vaccines are recommended regardless of whether or not you've had COVID, because these vaccines really give an opportunity for the immune system to develop those antibodies. This is a real opportunity to build protection, and it may be able to go above and beyond. There's a lot that we're still learning about this, but I think the important thing to take away is this is something that is recommended to do. And that's encouraging to know, that this is something that really, no matter what your status is with COVID, you're recommended to get that vaccine. Thanks so much.
Mahalo, Sophia, for your question. Our next question comes from Noilani.
Mahalo, Mema. Some people believe that the vaccine can have negative long-term effects on a person's health. Is this true? And is there any way to know at this point in time if there are any long-term effects? And if there is a way to know, what are these long-term effects and what would they be?
Yeah, that's a great question. Thanks for that. I'll start off, and maybe Dr. Leman can finish. One thing we want to state at the outset is we don't have a crystal ball. We can't predict the future. But I think one thing that is quite clear is when we look at the long-term side effects of a COVID infection, we really do have a sense of the severity and the duration. And this really does appear to be something that is much more common than a side effect from a COVID-19 vaccine. So when we're thinking about the future, we're thinking about the infection that we want to avoid and the potential long-term consequences. Dr. Leman, do you want to add on?
Thanks. So as Dr. Bonner mentioned, we are still learning, but we do have folks who were involved in studies, actually thousands of folks who were involved in trials of these vaccines, and that started as long ago as a year and a half or so. And those people are getting followed closely. And for those folks, we have not seen any of these, any long-term effects from the COVID vaccine, and that includes the 3 different types of vaccine that are currently available in the US. So have not seen this. We don't know for sure if maybe something will come up later, but we don't really anticipate that. Don't really anticipate that that's going to be a problem. We'll keep an eye out though, so that we can know if there is such a problem. But up to this point, that concern doesn't seem to be all that well founded. It seems like people are doing fine, even a year and a half out from the vaccine. Thanks, Mima. Next up.
Mahalo, Noilani, with this question. So when we were talking about the long-term effects, so when hearing others share these long-term effects, sometimes there also comes a lot of misinformation. And so we actually learned this in school. And so with this question, I was also wondering if you have ever, during the pandemic year, if you ever witnessed a peer, whether if it was on social media or in person, where they have shared any misinformation covering the COVID vaccine or the virus in general. And knowing your guys' work positions, you obviously know the correct answer. So if you ever witnessed this, or if it will happen, how will you guys respond to that?
That's a great question. I think it's something that we do experience all the time with friends, with family. And I think the important thing to start with is that people are seeking information. And so we want to honor that people are looking for information, they're trying to understand the COVID-19 vaccines, and that sometimes they haven't had an opportunity to really check out their data source and make sure that where they're getting the information from is reliable. And so that's why when I'm looking for information on COVID-19 vaccines, I'm searching the Oregon Health Authority website, I'm searching the Centers for Disease Control website, because that gives me accurate and up-to-date information that I can really trust and I can share with other people. And so oftentimes if I see something that looks like perhaps maybe a dubious data source, I'll ask somebody about where they got the data and why and what they're looking for, and then I'll offer, would it be helpful for me to share some of the things I've been exploring? And I think that's often a productive way just to recognize we're all looking for information and we're all trying to help each other out. Dr. Leman, do you have anything to add?
Uncle Richard, I think you're muted.
When you're right, you're right.
No
So,
worries.
and I guess I would just say whether we are dealing with COVID vaccine or COVID infection or any topic, it's very good when you are seeking information to think critically about the source of the information, because, you know, you can go online and you can find this or that in any old place, and somebody might say this and somebody might say that, and nobody's really monitoring whether in a lot of these places whether it's true or not. And so I think it is very good to look to sources that you can trust, and I think also to think critically about, if you see something that just happens to be on some website somewhere, you can't necessarily believe everything you read. So it's good to be able to do that kind of fact checking, and that's just a good thing to learn moving forward in your life, because whether it be about COVID vaccine or about anything, you want to be able to know that the information that you're getting is accurate information and is useful to you. So yeah, I just say that's a very important thing, and I think Dr. Bunner made that point very well.
So for the audience, remember from the two of our guest speakers that always, before you share your information, make sure to trust your resources and recite back to them, because we're the ones looking for the answer, so we don't know if it's correct or right. So make sure. Our next question will come from Kohoku.
Aloha. My question is, how does the vaccine affect menstruation in the menstrual cycle, and have there been any breakthroughs with why people are experiencing changes?
That is a great question, and it's something that's being explored now. There's been some reports of more bleeding during menstrual periods, and some differences. The way that we actually look at impacts of vaccination or things associated with vaccination is through a safety monitoring system. And so there are opportunities to pull all the information across all the people who were vaccinated, to try and see what are any trends, what are any patterns here. So it's something we're still looking at, and are hopefully we'll get some answers soon. Dr. Leman, do you want to add to that?
Yeah, Hoku, I actually did a little looking into this, and in the United Kingdom, in England, they have been collecting information on this, and they found that maybe about 1,000 women who had had Pfizer vaccine and 66 women who had the Moderna vaccine reported that they had had either longer periods than usual for a while or heavier bleeding. And Yeah, so it's difficult to know for sure whether that is actually directly related to the vaccine. As Dr. Bonner mentioned, we're looking into this to try to find out if that is actually related. But I guess since there are millions of people who got the vaccine and 66 who got the Moderna who said that they had longer periods, it might make me wonder if we asked millions of women who hadn't had the vaccine, have you had any changes in your menstrual periods? It may be that some of them would say, well, yes, as a matter of fact, since you ask, I have. And so I don't really know for sure that there is an actual cause effect relationship between the vaccination and the changes in menstrual periods. I guess one thing we have learned is that among people who report this, it tends to be more older women or women who have had a pregnancy or two. They are reporting this a bit more often. And happily, it sounds as though for the vast majority of people, it lasts for a cycle or two or three, and then it just goes back to normal. But yeah, we're still learning. Thanks for the question.
Mahalo, Uncle Richard and Dr. Kim. That was very informational. I actually did not know about this, but I think it's very educational, and to know something more, to learn something more every day. Thank you.
Mahalo Kohoku for that wonderful question, especially for us girls who are not educated on these types of things. And so our next question will actually come from Chloe.
Aloha. So I'd like to ask, because the Johnson & Johnson as well as the Moderna vaccine showed to have some serious side effects in some people, many are wary of getting their vaccine, whether it be Johnson & Johnson, Moderna, or Pfizer. What is the explanation behind these bad side effects, and how can we be sure that the vaccines really are safe to take?
Chloe, that's a great question. And I can start if Dr. Leman wants to add on. I think one thing that's really important to talk about here are what is a rare side effect versus what is a more common side effect. And so for people who are getting some of these COVID-19 vaccines, the more common side effects could be a bit of soreness in the arm, some tiredness. Sometimes people can have chills or fever. But what these are showing is that the immune system is working and that the body is gearing up to protect against a COVID-19 infection. Not everybody will get it. Doesn't mean that the vaccine doesn't work. But these, for some people, some bodies, this is how the immune system responds. We're still learning why there are some rare side effects. But I think one thing that is helpful to discuss is, so for example, if we're talking about Johnson & Johnson and blood clots, it's about 3 blood clots per million is what we're seeing now. But if someone gets COVID and they're unvaccinated, they actually have 2,500 times the likelihood of having a blood clot. So the risk is actually much, much, much higher if one contracts COVID. And I think that that's a useful way to think about this. When we talk about very rare side effects, the dangers from COVID-19 as a disease are just, they tend to be much larger. And Dr. Leman, I don't know if you want to add on to that.
Well, I think you made some great points there. And, life often involves choices. And in this case, there may be some risk with a vaccine, but there's also definitely some risk with illness. And so with the problem with muscle weakness that we've heard about, it sounds like maybe 100 people have reported muscle weakness after getting the Johnson & Johnson vaccine, and that's after like millions of people who got vaccinated. And then I guess we can compare that with COVID. Of 34 million people in the United States who have had COVID, 609,000 of those people have died. So that's almost 2% of the people who have gotten COVID have died. That's much more common, and death is a pretty final thing. So, based on that, for me and for my family, I'd go with the vaccine. And I did.
Thank you guys so much for your answers. I think they're probably really helpful, especially to somebody who's still contemplating whether or not they want to get the vaccine. Because I know when I was up to get mine, I was thinking, oh, should I wait until there's more information and like until we learn more about people's side effects? But it's really about like, what are the pros and cons? Like, what do you really want to get sick? Do you really want to take that risk? Or are you going to take a risk and not even really take a risk? Are you going to get your vaccine and keep yourself and everybody safe?
Thank you, Chloe,
Yep.
for that another amazing question. So for you two, since you both got your vaccinations, what symptoms did you guys get, whether it was after your first one or your second one?
After my first dose, I had no symptoms at all. I was totally fine. Growing up, I was really afraid of needles. And I would do whatever I could to avoid getting a shot. But I have to tell you, this one is so small that I really didn't even feel it. It wasn't even a pinch. It was less than that. And so that was really encouraging. For me, I had a 2-dose vaccine, and after the second, I had some chills, but I felt better within a few hours, and I just rested, had some water, and had no problems.
Yeah, I also had a 2-dose vaccine, and after the first dose, I had soreness in my arm, and it was a little bit swollen, and I think it might have been a little bit red, but that went away after a day. I did have a little bit of tiredness after the second dose, and also it did smart a bit.
As I mentioned before, for me on my first vaccination, I only got a sore arm, but I wasn't really worried about it because I know that was a common side effect. But for my second one, like the many of my Hula sisters here, we did get cramps or a slight headache, but we weren't that worried, like said, because we knew it was pretty common. And so, yeah, mahalo for that great question again, Chloe. Our next question is going to come from Angelina.
Aloha. Is the vaccine still effective and safe for people with autoimmune diseases or who are taking immunosuppressant medications?
So thanks for the question, Angelina. And yes, the recommendation is you can take the vaccine even if you have an autoimmune condition or are immunosuppressed. With some vaccines that have actual live virus in them, there's more of a concern about if somebody is immunosuppressed, because if it's a live virus, there's the possibility that they could still have the virus for a while, but there's no live virus involved with either the Moderna or the Pfizer, and the virus components in the Johnson & Johnson vaccine, it can't replicate. So that does not seem to be an issue at this point. We don't know for sure that the level of protection is quite as good in a person who has, say, decreased immunity compared to somebody else. And that's one reason that we all kind of have to help watch out for folks who are in that situation. They can get the vaccine and that may give them some level of protection, but that's one reason especially why it's important for the rest of us to get vaccinated so that we can avoid getting sick ourselves and avoid spreading it to somebody who maybe is not as well protected.
And I think one thing that that's important to note is we are always learning new things, and so scientists are actually really looking into this question now to try and understand this. But I think the important thing is the recommendation is still there to get the vaccine if someone is immunocompromised. And then for all of us, or for anyone who is not immunocompromised, there's also the recommendation to get that vaccine not just to protect yourself, but to help protect other people. And hopefully we'll continue
Yeah,
to learn more.
Angelina, so long story short, I was just going to say, long story short, there doesn't appear to be any downside to getting vaccinated if you have an autoimmune condition or are immunosuppressed, but we all still need to help protect those people.
Mahalo, Angelina, for that question. So, like, just to add on, a lot of people with the vaccination do forget that there is still a virus, and they use the vaccination as an excuse, like it's our overall cure. But for our audience, just remember that even though you got vaccinated, whether it was fully or you're just your first one, and even though other people may have gotten vaccinated, that does not mean that you don't have the ability to support those who still have not gotten vaccinated, because we're still in a pandemic and we're still in a virus. Just some things have been lifted, that's all. So mahalo again, Angelina, for that wonderful question. And our other question comes from Ku'ule.
Hi. So my question is, for people who have health conditions and are unable to get the vaccine, what are the best safety precautions that they can take to protect themselves and others from the virus?
It's a great question. Some of the things that we can do are to wash our hands, social distancing, masking. For those who are unvaccinated, these are the practices we've learned over this last year and a half. And I think as more and more people are getting vaccinated, those individuals can choose to get vaccinated themselves so that they can protect people who may not be able to be vaccinated or can't be vaccinated yet. Um, and they can try and avoid any exposures that they might have to COVID themselves. So it's about protecting one another, that we can try and help those and protect those who aren't able to receive the COVID vaccine. Dr. Leman, do you have anything to add?
That's right on. Certainly, as Dr. Bonner mentioned, masking and social distancing and hand washing is something that the person can do, but part of it's on us, right? Part of it's on us. And if we can make sure that we are not getting ourselves exposed to a whole bunch of COVID virus, and if we can make sure that we get vaccinated, if we can get vaccinated, in order to reduce the likelihood that we're going to transmit it to somebody who can't get vaccinated, those are all important things. And really protecting these folks in our community is a kako thing. We should all be doing that together in order to make sure that they're safe.
Thank you for sharing that with us. It sounds like a lot of what you guys had been saying was just to kind of stick with the safety procedures that we've been using for the last couple of months until herd immunity kicks in. And that's good to know because I know some people really wanted to get the vaccine but were unable to. And then I had another follow-up question that kind of connected to Angelina's question before mine. So I researched into it a little bit and I was looking at, so the Johnson & Johnson is a live vaccine, whereas Moderna and Pfizer are mRNA vaccines. Is there like a difference in effectiveness between the two types of vaccine? And is one more, I guess, like more likely to have a longer protection? And how exactly does an mRNA vaccine work?
Wow, that's 5 questions. But let's see. Let's take those one by one. So first of all, yes, there are the 3 different kinds, and 2 of those are mRNA vaccines. we think the mRNA vaccines are maybe somewhat more effective, like maybe up into the 90% effective range, 80 to 90% effective. No vaccine's perfect, but these are pretty darn good. And the Johnson and Johnson vaccine is not quite to that level, but also seems to do pretty well, over 60%. Kim, do you remember offhand what I don't remember the number off the top of my head, but while it's not quite as high as the Moderna and the Pfizer, it's pretty darn good at preventing illness, and also if someone does get sick, making sure that the infection is not quite as severe. The mRNA vaccines work by taking mRNA, which is a kind of genetic code, sort of. We all have DNA in our bodies, and RNA is what we use to copy the DNA and then translate that into whatever we need to make in the body. And so what these folks did when they made these vaccines is they tailored the RNA, the ribonucleic acid, so that it instructs our cells how to make one particular part of the COVID virus. And it seems to be a pretty conserved part of the COVID virus. It's there in multiple different strains. And so then our cells actually can say, oh, okay, you want me to make that? I can make that. And so then they use that RNA to then make that protein called the spike protein. And the body says, hello, what's that doing here? And it knows this is not something it's supposed to see in the body. And so it starts, the immune system says, this is not supposed to be here. I'm going to get rid of it. And so that's how it primes the immune system, so that the next time that COVID virus shows up, it's not going to have a chance, or it's going to have very little chance, because the body's ready for it and it's going to kill it. Does that help?
I'd be happy to add in, Dr. Leman, with your question with regards to effectiveness, because one thing that's really encouraging about these vaccines is in the clinical trials, they were highly effective, regardless of the vaccine, against severe disease. And so when we're thinking about COVID-19, that's really a measure that's very, very important. And when we look at the effectiveness against getting symptomatic COVID-19, these are a little bit different across vaccines. But part of the reason is also that these vaccines were tested in different places at different times. And so there were different variants moving around when the Johnson & Johnson vaccine was tested. So it's hard to directly compare. But one thing that is pretty encouraging is at the moment, these vaccines appear to be effective against the variants. And so if you've heard of the new Delta variant, it does appear that, that the vaccines are effective in preventing serious illness and death due to COVID-19.
I guess one other part of the question was, is there a difference between the various vaccines in terms of how long immunity lasts? And we're still learning. So we're following along people who were involved in those trials to see how long they continue to have an antibody response. And we'll continue to do that. And if a booster is necessary, we'll figure out whether a booster is necessary. And CDC, if necessary, Centers for Disease Control, where Dr. Bonner works, can potentially make that recommendation if it's necessary. So we're keeping on it, and we're tracking it down to find out the answer to that.
Thank you for explaining that to me. I heard a little bit about the difference between the vaccines, but I hadn't really, I guess based off of side effects, but I hadn't really heard about the actual structure of the vaccines. So thank you for explaining that. It's really interesting how they were able to take the messenger RNA and code the cells to, I guess, produce this protein to create antibodies?
Yeah, it's something that folks have been working on for a number of years. And so they had developed the ability to do it. But then when COVID came along, there was a place to use it. And so that's one reason that it was possible to get the vaccine developed so quickly, is that they had developed the technology, they developed the know-how, and then they were able to apply it quickly to this new virus. It usually takes a year or more, to years sometimes, to develop a new vaccine from scratch. And so it was pretty impressive that folks were able to turn these around as quickly as they did.
Thank you for also sharing that, because I know a lot of people had concerns about how fast the vaccine came out. And definitely hearing about the scientific reasoning behind why it was able to come out so quickly may comfort people and encourage them to get the vaccine if they have not already.
Mahalo Kule for that wonderful question. I definitely learned a lot within that small amount of time. So we actually have some questions from people in the audience, and our first question comes from Troy.
So a common argument I hear from people who are hesitant of or against the vaccine is that they feel the vaccine is still in a trial state. So they think, they're just experimenting on us. And when they throw around that word experimental, it's like it comes with uncertainty and just a negative connotation, like the government is making us their test rats and stuff. So what would you say to somebody who still feels like the vaccine is just an experiment, or like it's still in trial, and like how do you boost their confidence to get the vaccine?
That's a great question. And I think one thing that's important to realize is that all of these vaccines actually have gone through clinical trials. So they've gone through phase 1, phase 2, phase 3 clinical trials to be evaluated for safety. So are there any side effects, any concerns, as well as efficacy? How well does it work? And so over 100,000 people were involved in these vaccine trials. Right now, these vaccines have an emergency use authorization, which means that they are authorized to be used in these contexts. And we've seen that a huge proportion of the US population has already opted to receive the vaccine. So we're looking at over 150 million people have received the vaccine. So we in the US alone. So we do have that opportunity for those who are waiting and seeing. I think it's a good moment to look around and talk to a friend, talk to a family member, talk to your doctor or your primary care provider, and ask what they're seeing so far. Because I think what people are likely to say, and certainly your primary care provider, is that these vaccines are safe and they're effective. They have been tested according to stringent safety standards. Dr. Leman, do you have anything to add?
Nothing much to that. I would agree that, worldwide, we've got like maybe hundreds of millions of people who have successfully been vaccinated. I guess one thing, well, I guess that's on a different topic, but yes, there are a lot of people who have been vaccinated. We have been rigorously looking for any problems with side effects and have found small numbers of them by looking very, very, very carefully. And doggone it, it works. So I think this is not an experiment. This is taking care of a public health problem and trying to do that together as a community. And that's our job, to protect each other. So I guess that's what I would say. I do think one challenge that we haven't really mentioned, and this isn't a vaccine hesitancy issue, but you know, we have pretty good rates of vaccination in most areas of Oregon. A number of counties have over 70%, and the challenge is there are other countries in other parts of the world and where they haven't even been able to vaccinate healthcare workers yet, the people who are taking direct care of the people with COVID and who are like on the front line trying to help save people. And one thing I think we need to do as a world community is to find ways to make sure that we can get vaccine to those countries and to those people and make sure that those people can get vaccinated. So that's on us as a community, as part of the world community, and we need to work toward that. Dr. Bonner, I don't know if you have any comment on that, but that's just my feeling.
Yeah, I very much agree. I think one thing that's important to recognize is that this is an infectious disease. It doesn't respect boundaries or borders. And so it really matters from a human perspective, from a disease perspective, that everyone has the opportunity to be protected against COVID-19 or the virus that causes COVID-19. And there are a number of countries that don't have access in the same way that we in the U.S. do. And we hope through global partnerships that that can change. Thank you.
Mahalo, Troy, for that question. So for everyone, just remember it's a kako thing for everyone, not just one Kanaka, one person. So mahalo, Troy, again. Our next question from the audience comes from Lute.
Mahalo Pito and Mahala for the opportunity to speak in your space. My name is Lute Richards, and I mute myself back up again. I apologize. My name is Lute Richards again. I am the Pacific Islander Youth and Family Advocate for the Urkel organization, and I came with Tongan for my Tongan community with some youth, and I don't see them, and they were able to just message me their questions, and except for one, Peter Yongi here is in the space with us, and very much appreciated for this space again, and for Dr. Bonner and Uncle Richards, thank you for your wise knowledge and wisdoms that shared with us regarding this topic. I think my question, I have all the questions you guys been asked, and I appreciate that. Maybe one, and I apologize if I repeat it again, but the question is, when will vaccine be deemed safe for children younger than 12-year-olds? We have elementary, like I mentioned, I'm the advocate for youth and families of our Pacific Islander here in Portland, Portland Public School District. And we have kids who are being quarantined at home because kids at the elementary school age are found sick, so the whole class will have to be quarantined at home. So when will be a vaccine deemed that it's safe for them to take, or are they ever going to be given to younger ones, younger than 12-year-olds?
Lute, that is a great question and a really important one. The way that this is working right now is these vaccines are now in clinical trials in younger children. And what will happen is as these trials move forward, there's an opportunity to look at the results and see the effectiveness in younger children, and then in kind of a step-by-step approach, make the vaccines available to younger and younger children. But we start in adults when we're doing these trials, which is why the vaccines came first to adults. But absolutely, there's definitely a recognition that this is really challenging for kids to not have that access to the vaccination, and so it's being studied as we speak, and hopefully we'll learn more soon. Dr. Leman, do you have anything to add?
Well, as you said, we want to make sure that the vaccine is effective, and we want to make sure the vaccine is safe for folks who get it. And we are still figuring out whether that's the case for kids younger than 12. And that's not really going to be on Kim or me to make the decision. It's typically a situation where the information gets collected and it goes to the Center for Disease Control and Prevention Advisory Committee on Immunization Practices, and they make a recommendation. And also the FDA, the Food and Drug Administration, has to review the information and decide, yes, based on what we see, we feel that this is safe and we feel that it is useful. So I as Dr. Bonner mentioned earlier, we just don't have a crystal ball to know exactly when that is going to happen, but I know that there is work being done to see if that is possible.
That makes some sense. Coming from that, then why won't just kids benefit from herd immunity if more adults are vaccinated then, but yet they are still sick. But this is just from the school being told that they've been tested COVID, so the class will be quarantined. But so since a lot of adults are vaccinated, can kids still be immune to that?
Sorry, well, if you have a bunch of kids that are coming together in the same place, and if one of them happens to have COVID, then it's quite possible some more are going to get COVID. And we've seen, fortunately, kids in general do not have severe disease. That's not universal, but in general, they don't have very severe disease. But if they take it home to an unvaccinated kupuna, then we got problems. So that's another reason that we're thinking we need to be careful about kids, and there is the concern about whether there may be spread in schools that could then go home to others who maybe are not protected for whatever reason, and who might be at more risk for more severe disease.
I think one thing that's helpful to remember about infectious diseases is that it really matters who is susceptible to a disease. So who can get sick. And so even if overall the population is at a certain percentage vaccinated, there may be, if you have groups of children who are all not vaccinated, that's a pretty high proportion of a group that doesn't have that isn't vaccinated, that doesn't have that protection. And so when we're thinking about something like herd immunity, we can look at those big numbers, but it's also important to think about at a smaller level who is susceptible, or who could get sick, because that is how COVID-19 spreads, and that's why we're really looking to vaccines there. Thanks for that question.
Thanks so much. Thank you.
Yes, mahalo for the question. Mahalo to all those who have been asking questions in the audience. And so to close off today's Nakamali Talk story, we also got one more question from the audience. Intile.
Yes, Kalamai, we have a question coming in, and it's really for everyone. What do you, it could be Dr. Leman or Dr. Bonner, but
Delay.
really, yeah,
I don't think we see you. We see your background.
yeah, I know.
Oh, I'm sorry.
Usa kalani pea.
Oh, she just, did Mima just cut me off, guys? Oh man, no, I'm just kidding.
No, we hear you.
Totally. Okay, what do you recommend or what do you do? And again, this is for the youth in the panel here. What do you recommend or what do you plan to do if you encounter with vocal anti-vaccination individuals, especially when school starts? There's a feeling that you folks may run into families or friends that may be anti-vaccinators, and they want, basically the question is coming to the youth, like how will you handle those situations and handle those questions. And if you don't know, we would turn to Uncle Richard or Kim to see if maybe you folks have some advice. But yeah, they're wanting to hear from the youth on how you folks can advise other youth on how to take on those questions. So I don't know who wants to take this on. Chloe,
Chloe, do you have like a response?
anybody. So if you encounter someone, basically the question is if you encounter you're in a part of a conversation, and I think even Kool-Aid could answer this, right? You're a part of a conversation where there's students who are involved who are anti-vaxxer. They are not planning to get the vaccination. And the question is to all of you folks who are going back to school and you have gotten the vaccination and you do believe in the vaccination, how will you answer those questions or how will you handle those situations?
And anybody can open up this question.
If it would be helpful, I'd be happy to respond, but would love to hear from you guys.
Sorry, the side note of what's happening too is we are all in the same room. So we all have to switch on who turns off their speaker. But I think Chloe has her hand up. Go ahead, Chloe.
Chloe, go ahead.
I think it's just like staying in your bubble. If you know that somebody's not vaccinated and you believe in vaccination and you want to keep your bubble safe, then just keep that kind of restriction. Know if people around you are vaccinated and try to keep people around you vaccinated as well.
Also for me, I know it's going to be important to set boundaries with your friends and like other people in general, and just be like, hey, I'm not comfortable hanging out with you without like taking safety precautions, even though I'm vaccinated, you might not be, and I can still transfer it to susceptible members. Also, since I will be doing like extracurriculars, it's going to be important to, because I play a leadership role, and I'm going to have to enforce rules. My sister had to do something similar because she works at her college, and she said it was frustrating, but it definitely does help and it's effective to enforce policies like that. And you just have to make sure not to take it personal if people are disagreeing with you, and you kind of have to be kind of open-minded and understand that people may not always, maybe it'll go against their religious beliefs or personal beliefs or whatever beliefs their families may share with them. And so you have to just remember that we're still a community and we still have to stick together regardless of what what their opinions are.
Yes, mahalo Kool-Aid and Chloe on the other side of the room for sharing your answers. Dr. Kim or Uncle Richard, you could also add in any responses if you guys like to.
Sure, I'd be happy to. When I think about some of these conversations, I think when I hear something about someone's concerns or their position on vaccination, I think one thing that's really useful to do first is listen. To be curious, to try and understand where someone's coming from, to try and understand their concerns, and to empathize, recognizing that everybody's trying to do the best they can. They're trying to be healthy. And then I can offer, would it be helpful if I shared with you some of the things that that helped me as I was looking for information. Oh yeah, I had some concerns on this too. Would you like me to share some of the things that helped to put my mind at ease? And that invites people to a conversation. It doesn't have to be judgmental. It can just be curious and learning from one another. We don't necessarily have to persuade one another, but we have opportunities to exchange ideas. And I think that can be a way to approach some of these conversations that can be productive. Thanks.
Of course, mahalo for your final response. Uncle Richard, got anything, or are you all good?
I could not have said that better myself.
Right. So with that being said, mahalo nui loa to everyone who is in the audience, to our Nakamali Talk Story members, to our panelists, of course. And so before we close today, I would like to invite our students once again who helped put this Nakamali Talk Story together to introduce themselves.
Or just everybody can introduce themselves, please. Thank you, Mahalo.
Aloha, my name is Kina, and I am 11 years old. I am a sixth grader in the Hillsborough School District, and my pronouns are she, her, hers. Mahalo.
Hi everyone, I'm Sophia, and I'm a seventh grader in the Beaverton School District, and my pronouns are she, her, hers.
Aloha, my name is Noelani, and I am an incoming sophomore in the Beaverton School District, and my pronouns are she, her, hers.
Hi, my name's Ku'ule. I'm going to be a senior next year, and I'm 17. I go to school in the Beaverton School District, and my pronouns are she, her, hers.
Aloha, my name is Chloe. I'm an incoming sophomore in the Beaverton School District. I'm 15 years old, and my pronouns are she, her, hers.
Aloha, my name is Koku. I'm 16 years old and I am a rising junior in the Beaverton School District.
Hi, my name is Angelina. I'm 12 years old. I am the Beaverton School District, and my pronouns are she, her, hers.
Aloha, my name is Haley. I am a rising junior in the Beaverton School District, and my pronouns are she, her, and hers.
Again, mahalo to our amazing panel. Oh, Troy,
sorry.
go ahead. Sorry.
I'm Troy. I'm a rising senior in the Evergreen School District, and my pronouns are he, him, his.
And Lute.
Thank you. My name is Lute Richards. I am the Pacific Islander Youth and Family Advocates for the Portland Public School District, Pacific Islander students, and my pronouns are she, her, hers. Thank you.
Again, mahalo to everybody. Mahalo to our amazing panelists for today's Non-Kamali Talk Story, and to all the youth who have joined us today. We hope that today's Talk Story session has helped you understand and answer many of the questions you also had. Like we said before, we hope to use this platform as a safe space for all youth to come together and talk about the issues that we, a key component of today's society, are faced with as we move on into the future. No subject is off limits. So we hope to continue these sessions monthly, and we need you, our peers, friends, and family. For more information or ways to be involved, please email at kalohcc.org or visit www.kalohcc.org. So again, mahalo everyone for joining us today, and we will see you next time. Ahui ho.
Malama pono, ahui ho.
Mahalo, Uncle Richard. Mahalo, Dr. Kim.
Mahalo.